Welcome, everybody. We'll get started in just a moment, giving folks some time to hop on. If you just joined, please enter your name, your role, and your organization into the chat. And if you would like, if you have camera access, we would love to see your face. So please feel free to turn on your camera if you're in a place to do so. If not, don't worry about it. But we'd love to see you all while we're having this brief webinar today. Awesome. Great to see you all. Thank you, Heather, for putting that in the chat. All right. Laura, if we could go ahead and go to the next slide, we'll go ahead and get started, and people can be putting their information into the chat, welcoming folks in as more folks join. So, in light of doing that, my name is Courtney Kilgore. I'm a senior health educator within the County of Santa Cruz in Public Health and our immunization program. So great to see you all today. We will be having a webinar, or what we're sometimes calling a quick-inar, so a brief webinar to get you all up to speed on what we're seeing right now with flu. We'll also be covering some state general fund or SGF provider agreements and biennial reporting requirements. We'll be going over that briefly. We'll also be covering vaccine management best practices, and then we'll have some time for sharing resources and Q&A. Our team has also developed a few great slides of Q&A resources. If we do not have the time to get to them, we will be sharing these slides with you at the end of the presentation, and so you can take them back to your organization with all of the different Q&A and resources as well. Awesome. And so I'm seeing that Teams won't let some folks access their camera. If you can't access your camera, it could be the type of meeting that we have today. So if not, no worries at all. Thank you all for joining. All right, so we're just going to get right into it. We're going to cover a little bit of flu surveillance first. So this is a grim look at what we're seeing right now with flu so far this year within the United States. So again, the darker colors are high flu rates within each state. But the good news with this is that if you've been tracking this over the last few weeks, we saw dark purple in the Southeast region, Alabama, Mississippi, Georgia, the Carolinas. We're starting to see that shift. So we're starting to see those rates slowly go down, which is great news. But again, it's moving across the United States. So typically it starts on the East Coast, moves its way west. And so we're seeing highest rates in Texas and New Mexico. And then also we're seeing some pretty high rates within California. So there is a link to this in the slides. Please feel free to take a look at this. It's a great snapshot of what the US is looking like right now within our flu surveillance. Next slide. And then diving into what it looks like for California, I will note that this report is from mid-November. So we have likely increased our rates. And there is access to this wonderful report that CityPage puts together on their flu surveillance rates for typically the week prior. So right now we're seeing the highest rates within the southern region of California, and we are in that moderate as well within the Bay Area. So again, something we're all probably seeing within our practices and offices and things like that. But again, flu is out in our community, and so we need to be taking any precautions that we can to being able to support that. Next slide, please. And I know this is a flu webinar, but I wanted to touch briefly. Our leadership is calling it a triple-demic. People are saying flu, RSV, and COVID. Whatever you may be calling it this year, there are high rates of everything going around. It is virus season. And so we want to make sure that we're able to support our most vulnerable populations within our community. And so I wanted to show you just some quick rates of what we're seeing of RSV within California. So if you look at this plot, the dark blue line is what we're seeing for 22-23. So we have the highest rates so far within the past 4 or 5 years happening right now, and we're already hitting really like some of our highest rates ever. And so we want to make sure that we are protecting our most vulnerable populations. And right now we're seeing really high rates within our young under 4 population, and then our older 65 and older populations. And those again are those at most risk. And so while there's no vaccine available for RSV right now, it is encouraged to offer COVID-19 and flu vaccine at every visit to slow the spread of respiratory illnesses this winter. And I know many of you offer COVID and flu within your practices, but if you guys are overwhelmed and you're not able to offer it to everyone, I want to just call out that there are Inspire clinics happening all over the county still, and those can be found on our public health website, and I can put that link in the chat for you all just to have as a quick reference for folks if they're not able to get into your office, have another way to refer folks out. So again, just encouraging the conversation around COVID and flu vaccines and those good hand hygiene, good winter preventative practices. So thank you all so much for your time. I'm going to pass it over to Lauren for the next. Oh, I have one more. Sorry. So flu vaccination rates and survey, just briefly wanted to talk to you all about what we're hearing based on surveys that have been conducted this year for flu vaccination rates. And while we are seeing in one survey comparing this year's and last year's flu vaccination rates, there was it was higher interest this year, but prior to last year. But that rate is still quite low at 26% of those interested or those already getting vaccinated by October this year. And then another survey that we're looking at as well that I think has a lot of sway for us within our community is the intent to receive the influenza vaccine. And this was conducted in October, late October, where 28% have already received the vaccine, 31% probably or definitely will receive the vaccine, the flu vaccine this year. And then there is a chunk of about 40 folks who are unsure or will definitely not receive the vaccine this year. And so if you're looking at that, that is 40% of our population that is just on the teetering edge of they don't want it or they don't have enough resources or information. So we want to make sure that we're providing you all with the conversation topics, the vaccine, all of the supplies, things like that needed so you all feel equipped to provide this vaccine and have those conversations with folks to get the flu vaccine. So just really encourage you all to take this information back to your primary care providers' offices, back to your teams, back to your networks, and just encourage the vaccine as much as we can, as we are seeing these higher rates, and there's still quite a few folks to be swayed to get this vaccine, and there's opportunity available. And I think that's a big takeaway for us. I see Heather, just briefly, I want to call out Heather. Thank you so much for putting the Inspire links in the chat, and Lauren for putting the upcoming community clinics. Inspire is working with COE and with Community Bridges to provide these clinics out into the community. And so definitely encourage you all to spread the word about these clinics. All right, now I'm going to pass it over to Lauren. Thank you.
Hi. Okay, I guess we're going to take a turn into the clinical world here. So I really like this document. It's the Influenza Vaccine Identification Guide. It's put out by CDPH, and it splits the different flu vaccines by age group. So super helpful tool. And then as a note, multi-dose vials tend to contain preservatives and typically can't be given to children younger than 3 years of age and pregnant women, and that's per California law. And then also children under 9 with a history of fewer than 2 doses of flu vaccine are recommended to receive 2 doses during that same flu season, and that's typically 4 weeks apart. Next slide, please. So we're going to dive into State General Fund or SGF flu vaccine requirements. This is a program put on by the state. So a quick intro here. Planning for the SGF flu vaccine allocations begins in the spring. So if you have doses that you're interested in receiving, you can reach out to us. And then we always send communication out in early September. And this covers all the different program requirements and a ton of resources for flu vaccine for that season. And so some of the program requirements that we'll dive deeper into in a minute. So prior to vaccine redistribution, we need to gather your vaccine management plan. We need you to complete the storage and handling training, and then a signed provider agreement. After we redistribute vaccine, then there's some biannual reporting that happens, and it's also a requirement that doses be entered into care. Some limitations of the program include vaccine brand type and quantity. We don't essentially get to choose the vaccine we're getting. It's sort of like we get what we get. And then there's fluctuating vaccine availability. So sometimes later in the season, the state will reach out and say, hey, we have more vaccine if anyone's interested. Next slide, please. Okay, so this is a slide about care. And like I said, the SGF flu vaccine program, one of the requirements is that all doses administered are entered into care. And now the state has made it law that all immunizations administered must be entered into care. And this goes into effect January 1st. And something to note here is that race and ethnicity is a required field, and this is to help gather data on health disparities. Next slide, please. So one of the key components of the SGF provider agreement is this vaccine management plan. So it's required for SGF program, but this is really a best practice tool that helps identify key practice staff. You can have all of your storage unit information in one place, your temperature monitoring equipment, all in this document. And then you'll know when you need to recalibrate devices. So I think it's super helpful. Next slide, please. And so with storage and handling, EasyIV has these training modules online. They don't take very long. And if you're a VFC provider, you've taken them before, you can typically test out of them. So it's pretty easy to do. But this is a requirement for SGF, and we need this annually. So another requirement is biannual reporting. So these reports include the total doses received, total doses administered by age group, any vaccine wastage and any reason for waste, and then the number of doses still remaining in stock. So this will happen preliminary in January and then a final report in June. And then so the final piece is this provider agreement, and we already discussed all of those pieces that fulfill this agreement, but there are also some other components. And one of those is documentation. So all doses administered will be recorded. You need to track the manufacturer and the lot number. And then this needs to be retained for 3 years. So whether you're using an EHR or this is all done on paper, this documentation just needs to be retained. And then the administration fee for the vaccine is $2. So the vaccine is free from the state, and that's the max that you can charge for administration of the vaccine. And then we also require that the vaccine information statement, or VIS, goes to every patient prior to vaccination, and reporting any adverse events to VAERS within 4 weeks. And then also we'd like to know about that as well. So you could shoot us an email and let us know if something occurred. Next slide. And so if any of you are not an SGF provider and are interested in becoming a provider, essentially CDPH distributes the vaccine to local government or other agencies, and then we can redistribute vaccine as well. The target population is pretty specific. So this is for uninsured and underserved adults who don't have access to flu vaccine. So someone who has private insurance, their insurance should cover flu vaccine, but maybe their insurance doesn't cover vaccine, then this would cover that group of people. So reach out to us. Our email is located in the slides if you're interested in joining the SGF flu program. I'm going to pass it over to Laura.
Thanks, Lauren. I've just got a couple slides here talking about some things that practices and different organizations can do to try and support increasing flu vaccine uptake. As Courtney mentioned earlier, we definitely have a ways to go. This slide is created using information from the CDC on strategies to increase adult vaccination rates specifically, but these pieces of advice do, I think, apply to increasing vaccine uptake across the board. So starting with assessing the vaccination status of patients that are in your practice, and then trying to understand, even if you don't have the vaccine on hand, trying to figure out, where gaps exist for patients that you see, and figuring out ways to refer them out to providers that do have that vaccine available. After identifying those vaccines, make clear recommendations about the vaccines needed, offer them or refer out. Make sure that we're documenting, and as Lauren mentioned, the SGF flu program requires that those vaccines are recorded in the IIS, or the CARE system for us, California Immunization Registry. And then lastly, using data to improve process to try and encourage patients to get vaccinated when appropriate. And then many of you already do all of the things on this slide here. We share it a lot, but figure it's worth bringing up again that using the presumptive approach when talking to parents about immunizations is a really effective and proven way to improve vaccination rates as a whole. Saying things like your child is ready for the vaccine or is due for the vaccine. The 2015 study we quote most often is that 90% of parental vaccine acceptance occurs when using the presumptive approach versus the 16.7 when there's more sort of lax language used. Obviously, encourage folks to take time to dive into what those specific concerns might be about vaccination, and referring out if you can't answer a question, if there's someone else who can help provide context for that parent and patient family. Here we have our email address, immunizations@santacruzcounty.us. Feel free to reach out to us with any questions you might have about flu vaccine or the SGF program. All of us have access to this inbox, and so it's the easiest way to get your questions answered. But to that end, we do have about 10 minutes if folks have questions. I don't think you all are able to unmute, but if there are any questions that you have, we encourage you to drop them in the chat. We have some time to go over answers now. So I'm gonna give folks some time to drop any questions in the chat, but in the interim, we do have some Q&A prepared just in case this group didn't have anything right away. Heather asks, will the slide deck be available? Yes, it will. So we're going to send both the recording and the slide deck out to you all. Each of these slides, many of them have links to different resources that we've touched on today. While we're waiting for some questions to come through, Lauren, I'm going to ask you some of the questions that we have prepared already. So who's eligible to receive the SGF flu vaccine?
So uninsured and underserved adults who don't have access to flu vaccine.
And when should providers begin offering the flu vaccine?
So the CDC recommends a flu vaccine by the end of October, and this is before the spread typically starts to spike, right? But getting vaccinated later can still be beneficial, and vaccination should continue to be offered throughout the flu season. This says even into January, but the flu vaccine doesn't expire till June typically every season. So offer vaccination. And last season we saw a spike towards the springtime, which was kind of bizarre. So the other thing I think I want to mention is that most flu vaccines are either trivalent or quadrivalent. So that protects against 3 or 4 different strains of the flu. So even if someone was already infected with, say, influenza A, and they're like, I don't see a point in getting vaccinated, well, the flu vaccine can still protect them against different strains.
We have another question from Mariela Barba. In South County, do we have additional flu clinics that are not in those flyers?
I can answer that. So the Inspire and Community Bridges ones that have been in South County, or Inspire and COE clinics. Those are the only ones that we're aware of at this moment. Other providers would be pharmacies that people can go to as well. We are not offering any just due to our limited supply of vaccine, but anytime we do offer like a pop-up clinic or things like that, we do take a handful of flu vaccine as well. So we'll definitely have any of our flyers up as we have them.
Thank you.
Thanks, Mariella.
All right. While we're waiting for more questions, are there any considerations for giving the flu vaccine to special populations?
I'd mentioned this one a little bit earlier, but there is. So the multi-dose vial vaccines tend to have preservatives, and those should not be given to children under 3 and pregnant women.
And then there's a follow-up question. Are we planning any pop-up clinics?
Yeah, it's just popping that in the chat. So we don't have any scheduled for December that are hosted by public health, but we may have some in the new year. And as this, or if this changes, if we have more, or we have any in December, we'll definitely send them out to providers and everyone to keep everyone up to date with what we do have. So anytime we'll have new ones, we'll be sure to share those out. Thank you, Mariella.
This next question has a lot of text, Lauren, so you may need to break it down into a few questions. But what guidance is there for parents surrounding that all of the illness that's going around in the winter that Courtney was mentioning earlier?
Yeah, so caring for your child at home, there's certain symptoms, right, that we don't necessarily need to bring our kiddo in for, but helping to reduce their congestion, plenty of fluids, water. If your child has a fever over 100 degrees, you can give them Tylenol and ibuprofen. Some little trick I do is I alternate when my kids have a high fever. So every 3 hours, they're getting a medication to help with that. Obviously, you want to follow the dosing instructions for all medications. And then stay home for at least 24 hours after the fever to make sure that the child's no longer symptomatic. And then when to seek care. So symptoms of lung impairment would be fast breathing, flaring nostrils, head bobbing, grunting, or wheezing while breathing. In young kiddos, we'll see that belly breathing, and then any pauses in breathing would be a reason to bring your child in. Symptoms of dehydration, gray or blue colored tongue, lips, or skin, any decreased activity and alertness. If symptoms don't improve after 7 days, or if they suddenly get worse, that would be a reason. And then fever in those under 3 months of age should be brought in. Fever above 104 repeatedly for a child of any age is severe enough to be brought in. And then poor sleep or fussiness, chest pain, ear tugging, or ear drainage.
And there's a continuation of this slide that touches on, are there children who are at higher risk for severe disease in the winter time?
Yeah, so younger children, particularly those under 6 months of age, preemies, low birth weight infants, children with chronic medical conditions, so chronic lung disease or heart disease, immunocompromising conditions, or any neuromuscular disorders. These are populations that are at higher risk for severe disease.
Thank you. And I'll just note that all of the content from the last couple of slides have been from a press release from CDPH on guidance for parents about winter viruses, linked below on the slide. So when we send these out, if this information is useful for you to send out to your patient population or the communities you serve, definitely refer to those. If there are no other questions, see some folks typing, but while they're typing, I just wanted to ask if you have a moment to fill out a brief survey for us, letting us know how we did, how we can do better next time. That would be, we would greatly appreciate your feedback. I've linked it in the chat. You should be able to access it, although if you have any issues, definitely let us know. Courtney or Lauren, do you have any final thoughts to share before we wrap up?
Well, thank you all for joining. And I wanted to just say thank you to Heather. Laura, if we could include these flu resources from Inspire in our follow-up message, so we can get that out to folks, and there you can easily refer them to people. And we can include the flyers as well, just in the event, the more opportunity we can get folks vaccinated, the better. So if we can include that, that would be great. Thank you all for joining.
Thank you. Bye-bye.
Bye.
Bye all. Have a great day.